Hi, my name is Wesley Norris. I'm a licensed insurance agent in the great state of Arizona. I'm also licensed in Utah, Texas, South Carolina, Ohio, New Mexico, Florida, and Colorado. And I'm appointed with several carriers in each state to assist you with your Medicare benefits and options. Before we go any further, I want to let each and every one of you know that this is not an enrollment presentation. If after watching this presentation you have additional questions, please give me a call at 623-224-4226, or you can email me at wesley@wesleynorris.com. I want you to know that I do not work for the federal government and I do not work for Medicare. I am an independent broker and I am appointed with several carriers in the states that I mentioned. And if you decide to purchase a plan from me, the carrier may pay me a commission. Many years ago, when I became a Medicare insurance agent, I realized that each and every year, our Medicare beneficiaries receive stacks and stacks of information that they're supposed to read, understand, and make an informed decision. But that did not make sense to me because Medicare beneficiaries get all that information. They're supposed to wade through it, make sense of it, and make an informed decision. So I decided that my role, my goal as a Medicare agent is to present to you your Medicare benefits and options in a way that are clear, concise, and easy to understand, so that way you can make an informed decision. So as we go forward in this presentation, my goal is to make sure that you understand all of your Medicare benefits and options. And at the end of this presentation, if you have additional questions, please feel free to give me a call. And if you decide that you want to enroll in a plan, I would be more than happy to assist you with that. Now, as we go through this presentation, if you have any questions, write that question down. If I have not answered that question by the time we get to the end of this presentation, then give me a call at 623-224-4226, or you can email me at wesley@wesleynorris.com and ask your question, and I will be more than happy to provide you with an answer. So first thing, what is Medicare and when are you eligible? Well, Medicare is basically a group plan comprised of folks that qualify. To be eligible for Medicare, you must be 65 years of age. You can qualify under the age of 65 if you've been disabled for 24 months or if you have kidney failure. You must also be a United States citizen or a legal resident who has lived in the United States for 5 consecutive years. So the next question is, when can you enroll in Medicare? Well, when you first turn 65, you'll be in your initial enrollment period, and that is 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. That gives you a 7-month window to do your due diligence, decide which plan you want to go on, and get enrolled in that plan in your initial enrollment period. Now, the next enrollment period that you will run into is the annual enrollment period. It starts October 15th and it runs until December 7th. During that time, you can switch from one plan to another. You can switch from an Advantage plan to a Medicare Supplement plan, or you can switch from a Medicare Supplement plan to a Medicare Advantage plan, or you can switch from one prescription drug plan to another. Okay, whatever you decide, the plan will take effect on January 1. The next enrollment period that you will run into is the open enrollment period, and that starts January 1st and runs until March 31st. What this period allows you to do is disenroll from your Medicare Advantage plan, go back to original Medicare, and sign up on a Medicare Supplement plan and a prescription drug plan. It also allows you one more opportunity to switch from one Medicare Advantage plan to another. It does not, however, allow you to move from one prescription drug plan to another. Okay. Also, during that time period, the reason they came up with that is, let's say you signed up with a Medicare Advantage plan during the annual enrollment period, and for whatever reason, that plan made some type of change starting in the new year. Maybe the doctor left or some other situation changed. This allows you one more opportunity to make one more change to a different Medicare Advantage plan, as long as you do it before the end of March, okay? Your next enrollment period is the lock-in period, and that starts April 1, and it runs until the end of the year. During that period of time, you can only switch plans if you have a special election period. You can qualify for a special election period if you retire and lose your employer coverage, if you move out of your plan's service area, if you have been diagnosed with certain qualifying disabilities, or you have been diagnosed with certain chronic conditions such as diabetes, COPD, or cardiovascular disease. You can also receive assistance. You can also make a change if you're on Access, which is Arizona's version of Medicaid, or if you qualify for LIS/Extra Help, which is a low-income subsidy that is attached to your Medicare card, and it's dependent upon your income level. And to see if you qualify for either of these, contact your local Medicaid office or Medicare. So how does Medicare work? Well, Medicare basically has two parts to it. Let's see here. All right, Medicare has two parts to it. Original Medicare Part A and Part B. Okay, your Part A will not have a monthly premium because it was paid for through your 40 quarters of employment. It was that small deduction that showed up on your paycheck every week or every 2 weeks. Your Part B is paid for through a deduction from your Social Security check of $148.50 per month. Okay. I'd like to remind you that even if you stay with original Medicare Part A and Part B, or if you go with a Medicare Advantage plan or a Medicare Supplement plan, you will still have to pay that $148.50 premium unless you qualify for a state plan that pays your Part B premium. You're also required to sign up on your Part B when you become eligible. And if you do not sign up for your Part B when you become eligible, there is a late enrollment penalty of 10% per year until such time as you sign up for your Part B of Medicare. And once you're assessed with that late enrollment penalty, unfortunately, it never goes away. Part A of your Medicare benefits covers your hospitalization, skilled nursing facility care, blood transfusions, and hospice care. Your Part B of Medicare covers your doctor visits, primary care specialists, outpatient surgical procedures, physical, speech, and language therapy, clinical lab services, durable medical equipment, PET scan, CAT scans, MRIs, just to name a few. You are also required to sign up for your Part D prescription drug plan when you become eligible for Medicare. And if you do not sign up for your Part D when you become eligible, there is a late enrollment penalty of 1% per month until such time as you sign up for your Part D prescription drug plan. And just like the late enrollment penalty on your Part B, once it is assessed, it never goes away unless you qualify for extra help. So at this point, you've got your Part A and your Part B and your Part D prescription drug plan. Excuse me. You have satisfied all of the requirements set by the federal government. But one of the drawbacks of original Medicare is that it does not have a max out of pocket. So you need some way to control those costs. And what do I mean by it does not have a max out of pocket? Let me give you an example. Let's say you go into the hospital and you're in there for 60 days. That's going to cost you $1,484 for that stay. You come out of the hospital and you go into a skilled nursing facility and you're in there, let's say for 50 days. Okay, now it's starting to add up. Once you're out of the skilled nursing facility, let's say you're having a lot of follow-ups with doctors and you're having a lot of tests, MRIs, PET scan, CAT scans, all of those costs add up and you're looking at 20% each time. There's no maximum under original Medicare. So your first option is to try to control those costs. Your first option in controlling those costs is a Medicare supplement plan. A Medicare supplement plan sits on top of your original Medicare and fills in the gaps. Actually, the official name for a Medicare supplement plan is a Medigap plan because it fills in the gaps of your Medicare. Right now, the most comprehensive plan that you can get is Plan G, unless you turn 65 prior to 1/1/2020. At that point, if that's the case, you would qualify for Plan F. But right now, we're going to figure that you did not age in before 2020, so we're going to talk about Plan G. Plan G right now is the most comprehensive plan that you can get. Okay, it allows you to go to any doctor, any hospital, any facility as long as they accept Medicare. For someone aging in or turning 65, the monthly premium on Plan G is somewhere between $120 and $150 per month. So here's how it works. For hospitalization under your Part B, you go into the hospital, let's say January 1, and you're in there for 5 days. It's going to cost you $1,484. Okay, that is your deductible for that 60-day period. If you're in the hospital beyond that 60-day period, you will owe that $1,484 for the first 60 days. And then starting day 61, it turns into $371 per day. If you're in the hospital longer than another 30-day period, it turns into $742 per day. So as you can see, a lengthy stay in the hospital under original Medicare can be very, very pricey. Also on your Part A side is your skilled nursing facility care. It has a 100-day benefit period. Days 1 through 20 is a zero copay. Days 21 through 100 is $185 per day, okay? Up to the 100th day. If you're still in there beyond 100 days, then you'll have to pay the full cost of the stay. Regarding blood transfusions, Medicare says you pay for the first 3 pints. A pint of blood costs somewhere between $130 and $150. Let's see, let me pull this up for you. Here we go. All right. If you go into hospice, it is covered with a zero copay as long as you go to a Medicare certified hospice. Now, what I need you to understand with that is if it's certified, if you're required to go into a Medicare certified hospice, then that means that there are hospices that are not Medicare certified. So please be careful on where you go for skilled nursing care. On the Part B side, let's say we go back to the first of the year and you go to the doctor instead of going into the hospital. You're going to pay all or part of that $203 Part B deductible. Once that's paid, it turns into an 80-20 plan. Medicare pays 80%, you pay the other 20%. So for PET scan, CAT scans, MRIs, you pay 20% of the cost. Outpatient surgeries, you pay 20% of the cost. Durable medical equipment and prosthetic devices, you pay 20% of the cost. And again, as I said, your Medicare Part A and Part B does not have a max out of pocket. So let me show you how your Plan G would come into effect and how it would work for you. Plan G on your Part A side, it covers your hospitalization up to 365 days. It pays that $1,484 for the first 60. When it switches over to 371, it covers that. When it switches over to 742, it covers that as well, all the way up to 365 days. Your skilled nursing, days 1 through 20 is a zero copay. Days 21 through 100, $185 per day. Your Plan G covers that. Blood transfusions, your Plan G picks it up from the very first pint. Hospice care is covered as long as you go to a Medicare certified hospice. On the Part B side, your Plan G requires that you pay the $203 Part B deductible. Once that's paid and it switches over to 80-20, Medicare pays the 80, your Plan G covers your 20%. So your PET scan, CAT scans, MRIs, that 20% is covered by your Plan G. Outpatient surgeries, your Plan G covers your 20%. Durable medical equipment and prosthetic devices, your plan covers your 20%. So you don't have to worry about that max out of pocket not being there and putting you in the poorhouse, okay? All right, now, also, the Medicare supplement plan is not tied to the annual enrollment period. So if you find another carrier that has a better plan, has better rates, you can switch over to that plan at any time. I must caution you, however, that if you go with a Medicare supplement plan, you must get a standalone prescription drug plan because a Medicare supplement plan does not cover prescription drugs, okay? Now, please remember that your Medicare supplement is just one of your options under Medicare. If you'd like more information, please give me a call at 623-224-4226, or you can text me at 623-238-8491. And you can also email me at wesley@wesleynorris.com. Again, my name is Wesley Norris. I'm a Medicare insurance agent. I operate the Wesley Norris Insurance Incorporated. Have a great rest of the day.